And the number one thing that causes guys to not achieve the expectations they have of TRT is regular alcohol consumption. And there's a huge cohort of men who don't understand, because of, culture practices, or, their own biases, or, for whatever reason, that you can't drink, 2 to 3 beers a night or 10 to 12 beers on the weekend and be healthy. Now, there can be an exception to the rule. You might say, well, I know this guy who drinks like that and he doesn't have it. Cool. Exceptions don't disprove rules. That's not how science works. But for the vast majority of guys, alcohol consumption is the number one thing holding back their TRT that is so easy to fix. I mean, losing 10, 20, 30 kilos of body fat, that's difficult. Not picking up a beer bottle and going like this is much easier. So it's an easy thing to stop, and it's an easy thing to cut out. And there was a study that came out recently, Rhonda Patrick referenced it, where it showed that basically lifetime consumption of standard drinks equated in terms of negative outcomes on mortality as cigarettes. So one beer is as bad as one cigarette for your overall health. So alcohol's terrible. And I think that everyone is so much better off not drinking any alcohol. I think the best approach, if people do want to drink alcohol, is to have 1 to 2 drinks on a special occasion. Friday night is not a special occasion. And if people are going to be, for the guys who are like red wine connoisseurs or whiskey connoisseurs or craft beer connoisseurs, I think the absolute maximum you can look at drinking is 1 to 2 drinks, 1 to 2 times per week, but you'd be significantly better off with 0 or at the lower end of that. And for guys who are going to insist on continuing to drink, I think you should take glutathione. But to answer this guy's question, he is going to be much better off without it. His entire body is going to function much better without it. It's not going to impact his testosterone numbers. Well, I mean, if he was drinking 2 or 3 beers a night, it could be impacting his liver's ability to metabolize the ester. So it could impact his numbers depending on what his individual alcohol tolerance was. But for the most part, it will reduce his C-reactive protein. It will reduce his LDL. It will reduce his triglycerides. It will generally reduce AST and ALT. It will reduce blood pressure. It will reduce hematocrit and hemoglobin. And it will increase his overall sleep quality, his well-being. His IGF-1 levels will all increase. So blood moves in very favorable directions when people stop drinking like this. And 2 to 3 drinks a night is a lot of alcohol. Like over the course of a week, that's a lot of alcohol.
Yeah, well, it's easy, Dave, to say when you don't drink at all, but I have also a lot of patients in my practice who think it's very normal to have 1 drink a day, 2 drinks a day. A lot of people think that's just normal, socially accepted. So.
Yes. And that this casual alcoholism is one of the most challenging things for guys to unlearn when they get on TRT, because I see guys all the time who are spending hundreds of dollars a month on gut supplements. I mean, if you're having gut issues and you're drinking alcohol, don't worry about the gut supplements. Just stop drinking booze and it will get way better. But I see guys who are biohacking and eating super clean and working really hard on their diets, and then they're binge drinking on a Friday night, or they're drinking a couple of drinks every night, and they don't realize that they're completely derailing all the hard work they're doing, and it's just not worth it. The buzz and the intoxication that people get from alcohol, not only is it very mild relative to the damage they're doing, but it makes you feel like shit the next day. And if people are drinking like this and you stop drinking for a couple of weeks, take a photo before and after, and your face will look noticeably less bloated.